Hello, I'm Deborah Kafori, your Multnomah County Chair, and welcome to the State of the County 2021. On a typical year, the state of the county is about ups and downs. This year, the state of the county is a state of emergency. We are here tonight to ask you for your help. We are facing a virus, COVID-19, a virus that before January, no one in this country had ever seen. On Tuesday, Multnomah County saw its first case. On Wednesday, I declared a state of emergency. That declaration gave us the ability to meet new and growing needs. It has now been extended 4 times.
We mean it when we say it. Stay home if you are sick, wash your hands regularly, and assume this virus is in the community.
Closing public libraries in Multnomah County like this is an extraordinary measure. It's never happened in modern times.
As of today, we are no longer allowing social visitation at our 2 jail facilities to help prevent any further spread of the virus.
We know there are seniors who won't be seeing their friends. We know that there are thousands of kids who rely on school meals.
What do we want? Justice! When do we want it? Now!
As our country and our community faced this once-in-a-century pandemic, we also faced a much older and no less deadly pandemic of racism. And systemic injustice. And then, as if we needed further proof of the climate crisis, in September, our state experienced extraordinary wildfires. We faced choking, toxic smoke that blanketed our community for a record 5 days and drove thousands of Oregonians to flee to Multnomah County. In a typical year, any one of these events would have been daunting. Together, they have been traumatic, overwhelming, and gut-wrenching.
I'm Dr. Jennifer Vines, the Multnomah County Health Officer.
But at every turn,
I'm going to talk today about hand washing.
Multnomah County was there.
Today, I'm going to show you how to create a face covering.
Make sure it covers your nose, mouth, and chin.
Think about what supplies you might need.
To educate.
ويجب أن نتأكد من
Use las tiras o bandas elásticas que van alrededor de las orejas.
To track the virus. To distribute PPE. To provide safe shelter and housing. To organize meals.
I have these moms and dads who say we can't really sleep because of the burden that they have to carry, that they don't have income, they don't know what to say to their kids in the morning. That's really what keeps us going every day.
To hold fair elections. Again and again. To vaccinate. To appreciate our community. Good morning, everyone. And to carry on with county business. Planning an earthquake-ready Burnside Bridge. Making Cornelius Pass Road safer. Opening a new school-based health center. Passing the first supportive housing services levy. Passing the library bond. And, for the first time ever, approving the ballot measure Preschool for All. Building the new courthouse. We've risen to every challenge, but the work of Multnomah County is far from complete. As you just saw, Multnomah County has stepped up in so many ways to help our residents navigate immense and cascading challenges. But as we stand at the edge of a post-pandemic world, we have the opportunity to reflect and to ask ourselves, who can and should we become as a community after a year like this? And what does it look like to move forward? Because what the events of the previous year exposed to all of us, beyond a shadow of a doubt, is that the normal we had been living in was marred by inequities and injustices. So for all the wishful thinking about going back to normal, we can't go back to what was. To merely rebuild what was would be to deny the unforgettable sights, sounds, and lessons we've gathered in this past year. Instead, we have to use these experiences to imagine bigger, to propel us to build something better, to capture the sense of and our duty to the possible and not to the past. Our recovery from the pandemic and the years that follow must move Multnomah County toward a new place of strength, health, and hope. As the COVID-19 crisis proved, stable, safe housing is imperative to people's physical, emotional, and mental well-being. Without it, surviving outside is grueling, it's dangerous, and it's just that, a matter of survival. On any given night, 12,000 people in our community are able to lock a door behind them and go to sleep under a roof, in their own bed, because of our homelessness response system that combines housing with supportive services. 12,000 people who would otherwise be homeless if it weren't for that housing. But one look at the tents lining many of our streets tells us that this is simply not enough. However, the way our community responds to homelessness is at the doorstep of transformation. Last May, voters approved an historic investment in supportive housing services that will allow us to meet the challenges of homelessness for decades to come. This infusion of funds will drastically expand our response system, which gives people keys to a home and, just as critically, connects them to the supports they need to stay in that home. The county's new Behavioral Health Resource Center will bring life-saving supports to people experiencing chronic homelessness in the downtown core. Once open, it will offer a day center, a safe 24-hour shelter, behavioral health treatment, and transitional housing. We are on our way toward becoming a community that is fully prepared and able to support every neighbor experiencing chronic homelessness. And I'm also finding great hope today in how community members are engaging personally with the challenge of homelessness, not only with their dollars and donations, but in their willingness to see that our community's future is wound tightly together with that of our neighbors who are surviving on the margins. A business owner recently shared with me that she sees her own success as tied to the stability and health of the individuals who sleep in the doorway of her shop. She didn't say that success depended on removing them from her neighborhood, but in their stability and their health. Community members like her are rejecting punitive and superficial approaches that only address the visibility of homelessness in favor of solutions that help our neighbors escape it. Changing lives requires compassion, consistency, and traveling alongside someone as they get connected to the services they need. That's what Multnomah County does, and that's what we will continue to do as we transform and strengthen the ways in which we serve those who are hurting the most. For decades, Multnomah County's public health has quietly, reliably, and effectively prevented disease and deaths in our community. But what's often gone unnoticed is all the work surrounding disease prevention, health education, outreach, harm reduction, and so much more. Well, that is until this past year, when the pandemic threw a spotlight onto the breadth and depth of public health responsibilities. And to be honest, it's taken the past year for me to gain a better understanding of public health's reach. And I continue to be impressed and grateful for the wide-ranging work they are doing to keep our community safer and healthier, whether we recognize it or not. As community members begin to wrestle with the lasting residual trauma of this once-in-a-lifetime emergency, the work of public health will be critical to keeping people from plunging through the social fabric that has been frayed beyond our imagination. Through the work that they've done for years and the ways they've risen to the challenges of the pandemic, we have seen the transformative potential of a robust and ambitious system that creates healthier conditions for all residents and strengthens historically overlooked communities. That is the vision the county is committed to pursuing as we move forward, where every dollar that we invest in our programs and people returns as a healthier and safer county. Because health isn't just about keeping the community safe from viruses and treating wounds. As we've seen over and over again this past year, our community's health depends on addressing all the inequities that put people's health and lives at risk. So as we look forward, that means Multnomah County Public Health will be a crucial pillar in the work of confronting the community's biggest challenges, like housing instability, climate change, gun violence, and racism itself. All of these major challenges are direct legacies of systems that weren't designed to serve or benefit people of color. Multnomah County is creating pathways to build something better. But better is only possible when we build in a way that intentionally centers and partners with the communities who have historically borne the brunt of inequities and injustice. And at the same time, communities of color do not need the county to tell them what's wrong or how harms can be repaired. They already hold deep wells of wisdom and creativity, brilliance and energy that, when combined with the county's resources, can translate our shared visions for equity, inclusion, and justice into reality. We've taken this approach as we crafted the plan, directing how the county should invest our supportive housing services funding, as we designed the Behavioral Health Resource Center service model, and as we built a COVID-19 response that prioritizes the needs of communities disproportionately impacted by the virus. This spirit of co-creation is essential to bringing equity to life, creating material change in the lives of those who have been harmed by systems built to oppress, to minimize, and to silence. It requires a more inclusive, intentional process, but at Multnomah County, we are as committed to doing things the right way as we are to doing the right thing. Equity and urgency are two sides of the same coin. For example, the voter-approved Preschool for All measure gives us the opportunity to build for the first time an early childhood education system that is created in partnership with families and communities who have been priced out and left out. With their leadership and partnership, we are building a new way of caring for and educating preschoolers where access and racial justice are foundational values. Meanwhile, we are using our Transforming Justice initiative to envision and implement a new model of public safety that is decoupled from the history of institutionalized racism that the criminal legal system is founded on. But we're not doing it alone because we can't. In this process, we're elevating the voices of community members who have experienced firsthand the brutality and the harms of a system explicitly designed to oppress people of color. And together, we're poised to build a new model that promotes healing, stability, and true community safety. Multnomah County is also building equity through our budget, which reveals what we value and aligns our community to the future we wish to build. But our values can't just live on paper. What we invest in must meaningfully improve the lives of our community members. For about a decade, the county has used our equity and empowerment lens to help us design our programs in a way that better connects our values to the real-world differences we seek to make. And now we're applying that lens to our budgets, so that every part of our organization, from transportation and IT to human services and health, plan, use, and measure the effect of their limited resources in a way that improves the lives of those we serve. We will use every tool we have to ensure that our work always pushes us closer to a future Multnomah County where we lift up every community member. Every challenge of the last year has been met by the dedication, ingenuity, and adaptability of Multnomah County's 6,000 employees. I am profoundly grateful to all of you. But I'm also aware that our staff can only show up as their best for the community to embody equity, justice, and inclusion when they experience those values in their own workplace. So I'm committed to ensuring that the county's workforce equity strategic plan remains fully supported as we take steady steps towards becoming an organization that practices our values inside and out. I know that we are all eager to leave behind the events of the last year. But at Multnomah County, we're using the lessons of this unique moment in our community's story to build the just and equitable community that I know we can be. And I hope you'll join us as we build it together. Finally, one of the things I am the most grateful for is to lead a board that brings such a diversity of professional experience, expertise, and passion forward on the behalf of the people of Multnomah County. So today, for the first time in the history of this speech, I've asked each of my colleagues, Commissioners Sharon Myron, Sushila Jayapal, Jessica Vega-Peterson, and Lori Stegman, to reflect on their priorities.
Despite being in crisis management mode, this year Multnomah County has done important, visionary work. We now must focus on what our community needs for the future: recovery, resiliency, and reimagined systems. Of paramount importance, we must act on a shared vision to address our homeless crisis. We have a historic opportunity to provide safety and stability for people who are houseless at this unprecedented moment in time. We need to get this right. In particular, we must invest in services that urgently reduce harm for people living unsheltered and in the broader community, while we're working on those longer-term solutions to prevent and end homelessness for good. And part of this long-term work is addressing critical deficits in our system of behavioral health care. It's not just a matter of more services, it's really a matter of better systems. Filling gaps will not fix an under-resourced, poorly designed, and poorly managed system. But working together to create and resource a better system will change lives, especially as we're facing the profound isolation, school closures, job loss, and untold trauma stemming from COVID. We must also continue our work to re-envision law enforcement and community safety, particularly where the criminal legal system intersects with behavioral health and houselessness. I championed an effort looking at people who frequently come into contact with multiple systems, including emergency housing, so our shelters, also ERs and jail. This showed shocking disconnection and overlap. Our multi-layered, uncoordinated responses aren't working to address root problems, and those who are most vulnerable suffer as a result. This year, I'm excited to advance this intersectional work and carry forward key recommendations from this quality data and powerful collaboration across sectors. Our work is not just about getting through COVID, but it's about moving forward with renewed determination and ensuring that our entire community will thrive.
Two themes have risen loud and clear from the past year: racial justice and interconnectedness. The pandemic and the movement for racial justice have forced us to confront the systemic inequities faced by Black, Indigenous, and other people of color. And they have shown us that we are all interconnected. Combined, they have shown us that the health and well-being of any one of us is literally dependent on the health and well-being of the rest of us. I'll be carrying these themes with me into the next year with a focus on three particular areas. First, I'll continue to advocate for an equitable response to the pandemic equitable access to testing, vaccine, and the resources necessary to helping our families, businesses, and neighborhoods emerge strong and resilient. And I'll work to ensure that we implement the lessons we've learned about the ways in which our systems have failed those community members most at risk. My second priority will be successful implementation of our groundbreaking supportive housing services measure. This will require clarity, transparency, responsiveness, and accountability. And at the same time as we're developing those long-term solutions, we also need to respond to what we see on the streets right now by providing a continuum of options that meets people experiencing houselessness where they are and with what they need. And third, community violence is also a public health imperative, particularly for the Black and Brown communities most impacted. I'll work with partners on neighborhood-focused strategies to prevent and respond to violence, while continuing our work on the broader revisioning of public safety systems that's taking place at the state and local levels. I'm honored to serve with this dedicated Board of Commissioners to lead us through these challenging times.
In November, voters approved Preschool for All, a historic investment in our children, working families, teachers, and small business owners. The measure, which will total over $300 million in annual spending when fully implemented, was years in the making. And the components of Preschool for All are central in my attempt to build a more equitable society. Preschool for All addresses the growing wealth inequality in our community by taxing the most wealth. It also pumps that money back into the salaries of teachers and assistants, who are too often underpaid and unable to make ends meet. And it lifts an enormous burden, often well over $1,000 per month, from the budgets of working families. It uplifts small business owners, who are often women and women of color, that operate the preschools and childcare that form the backbone of our local economy. And finally, it centers racial equity. From the concept to the policies to implementation, Preschool for All is deeply rooted in the experience of Black and Brown and all communities of color. Preschool for All must be implemented properly, which is why over the next year, I'll continue to work hard in partnership with this board to make sure the program is successful and enrolling children by the fall of 2022. The values and community-centered process of Preschool for All is reflected in the work I do on the other critical issues facing our community: public safety reform, housing instability, and environmental justice. We can build on this accomplishment and do much, much more to build the equitable society we all deserve.
We have all been through so much together this past year, but despite those challenges, I could not be more proud of how Multnomah County and our employees stepped up every time. Einstein said that in the midst of every crisis lies great opportunity. I believe we've been presented with rare opportunities that will serve as the foundation of the transformational change that we so desperately need. This board stands ready to do the hard work at hand. And together, I look forward to continuing the economic mobility work that I've been focusing on for the past 4 years. I believe that poverty is at the root of many of our social and economic challenges. By identifying and analyzing geographic and social influences, we can better develop policies that increase mobility. Evidence-based data, like this effort my office has led, helps us strategize, plan, and allocate our limited resources to do the greatest good. From building a flagship library in Gresham to establishing a school-based health center at Reynolds High School, to siting a vaccine distribution location at Gresham High School, to distributing $1 million to East County businesses with priority given to BIPOC and women-owned businesses. As we begin to recover from this pandemic, I am optimistic because I know that by working together, our values, not our circumstances, will define us and set us on the path forward.
Thank you for joining us for the 2021 State of Multnomah County.